present doctors to the 1316th daily webinar organized by International Forum for Promoting Homeopathy. And our guest for today is Dr. Ratna Bhatt. First of all, let's start the session with the 2-minute silence. Okay. So the guest for today's webinar session is Dr. Ratna Bhatt. She is a MD homeopath, and she has been practicing homeopathy for the past 15 years. She has an experience of 15 years. And also she is a professor and guide and mentor at Ahmedabad Homeopathic Medical College in Materia Medica department. She's a professor there. And in Ahmedabad Homeopathic Medical College, Gujarat. And she mainly handles cases related to hair fall, sleep disorders, psychological issues, gynecological problems, pediatric problems, and also diseases pertaining to immunity disorders. And she integrates into her practice many other practicing healing modalities like Reiki and regression, past life regression therapy, theta healing, and tarot guidance. So she is integrating a lot of things along with homeopathy into her practice. And the topic of her webinar presentation today is a well taken case is half cured. So welcome Dr. Ratna Bhatt ma'am to the IFPH forum, and you can now start the session.
Dr. Neha, you will be able to, shall I make you the host so that you can,
Yes, sir.
I will make you the co-host. So,
yes, yes, sir.
Usually the main host I'm going to make you now, okay?
Okay, sir.
You understand me?
Yes, sir.
So
yes, sir.
Putting you, I have already made Dr. Ratna Bhatt as the co-host, and I am making you the host now.
Okay, sir. Okay, sir.
So, yeah, welcome, Ratnaji, you are welcome.
Thank you so much, sir. Thank you so much, Sahani, sir. Thank you so much, Dr. Neha. And thank you so much, everyone who is present here. And I feel so privileged to be a part of PH forum, that I'm able to share some of my views. And I'm really, really grateful for everybody to make me a part of this. And I hope I'm audible enough, clearly audible enough.
Yes, ma'am. Yes, ma'am.
Yes, thank you, Neha, ma'am. And I really consider myself lucky that I've got a chance to present my words in the month of April, and when Dr. Hanneman sir's birthday is approaching.
Yes,
so it's a kind of blessing to me. And the magical words by Dr. Hanneman sir, that a well taken case is half cured. So here when I was deciding the topic, it just came to me while attending my Organon lecture. So I thought of integrating it with Organon and Materia Medica part, because in 2024 I had set some of my goals in professional life and for the homeopathic. So I thought that this is a year for me to give something to homeopathy, because it has given me a lot. It has given me a lot in my life. And so my point of sharing this is just to make things more clearer and more easier, because many a times it so happens that we in day-to-day practices miss out small things that we had studied when we were practicing at very young age. So I think that these are small but very important, last but not the least, and very small but very important things which we all need to take care. And probably it will guide the young budding homeopaths to be more sure and how not to make mistakes in prescription. Because as we are all aware that homeopathy has its beauty with the way of case taking, because no other pathy has so beautiful way of taking the case than homeopathy. So this is Master Hahnemann's great gift to homeopathy and all of us, the way of case taking. And so in first part of my lecture, I will tell something about what is a well taken case. So as per
Ma'am,
me, yes.
ma'am, do you have some slides?
No, ma'am, I had asked sir, so I have not prepared actually.
Okay,
Uh,
okay, it's okay. Yeah, you
okay.
can continue,
Yes.
please.
Yes. So, in a well taken case, what do we mean by well taken case is that it should include not only the physical aspect, but the mental aspect, the personality traits, the likings, dislikings, the disease picture, and overall a personality picture of our patient. So we know that in different pathies, we are not paying much attention to what a person is actually suffering as a whole, but we are here taking care of our we are here focusing more on treating the patient rather than treating the disease. So in our making the case more presentable, more well taken, because it serves the purpose as for us as a homeopath in process of making individualization. We all know that how important individualization is there in our pathy and practice. So my points are very simple, and I would like all of your feedbacks here, because I am going to share my vulnerable experiences or my mistakes that I have made, to make sure that we all take care, or the students who will see that will be aware about making these things into the practice, that they should be careful. So, firstly, for a well taken case, my first point is all about observation. So, we know that how important observation. So, my few of the students are here, and those who are practicing, who are trying to practice, I would just like to interact a bit and know something about what is observation according to the students. Can anyone would like to answer? Any of the students? Okay. So continuing more forward, for me, according to making it more simpler, that observation is to see something with a purpose. That is a general understanding of seeing something with a purpose, right? And very nicely in our aphorism, Dr. Henneman sir has described in Organon, aphorism 6, about the way of observation, like what should be there in observation and what not should be there in the observation. So, Dhruvi, would you like to answer what are the types of observation? Can you tell? Y-
Ma'am, Dr. Ratna, I would like to request that you can, just share your views
Okay,
first. Yeah, and
okay,
in the end, you can have a question answer or an interaction session. First, you can
right,
tell your own experiences and what you are trying to say. Then at the
right.
end, you can keep the
Okay, ma'am. I'll take care. I'll take. Yes. So, in the way of observation, when we start, it's in the way of observation. There are two types where we make mistakes. One is in mal observation, and second one is with the non observation. So, in mal observation, in initial practices, it so happens that many a times we as a physician might mistake in observing the things, so that it happens that I'll share some of the stories from my side. Here is that when as a, we had intern students, and we had told them to take some of the cases, and they have been, we have told them what is to be observed, or what physical symptoms are to be seen, what body language and everything was told to them before they start their case taking, and they were in very enthusiastic mode and making the case taking. And one of the practitioners, they came with the case, and one of the remark was written in the way of physicians remark that, ma'am, the patient was constantly sitting like this, and this was a particular gesture of the patient that he has not even missed out for a minute while case taking. So the physician, we were just curious about, okay, what this gesture can look like. And once the patient, when the physician interacted with the patient and came to know about the history of, he was suffering from eczema, And then we asked about like why he is keeping the hands like this. And the patient told very surprisingly that he was not aware that with eczema also the tooth pain can be cured, or with the toothache can also be taken care of. So a patient was actually having toothache and he was trying to hold this by hand so that he feels better. So this is one of the simplest example of malobservation, that whenever really we are making false observation. So in initial practice days this might happen, or even it might so happen when we are really busy in our clinic. But as we observe, as we keep practicing, the things will come on its way. So this is the minutest thing, but it makes sometimes really funny experiences when we actually pass through. So one more example of this mal observation, or along with the observation, we all know that our master has also told about prejudiced observation and non-prejudiced observation. So when we want to take a case in proper way, when we really want to have a well taken case, we should be free from the prejudice. And one of my examples I'll share. Like one of my friend, we had been in the college time together, studying together, and after that I wanted some documents work to be done by him. He is in the claims and policy and everything. So I was just taking his views out about some of the things. And he was like he had given me all the information, and within 3 days all my doubts were cleared, and I was given the best option that is available. So I was very much surprised to see him progressing so much, because in college time I knew that he was not that much organized, or he was not that up to the mark with his things. So I was so curious and I gave him compliment that my dear friend, you have really improved a lot. You have been so methodical and so organized, and you have made the things very well. So he started laughing and said to me that actually you are my friend and you are a doctor, so let me share that since few days I am experiencing a kind of forgetfulness. So in that way, I have made a plan that I keep getting reminders every few days, and 3 days are the maximum limit. So I know that I have to work accordingly, and I don't want to lose my business. So in this, if I was like, I was considering it as that he might have improved or he might have become this, but ultimately it is some driving force is different. So these are small things. Like, my point of saying this is that when we are writing something in case, when we are making a presentation on the person, when we are actually collecting the details, we should be in that center, and with the non-prejudice observation and opinion, so that we are there and we will be able to write the things on the right way, and don't get mistaken by others. So this is one of the example from my side of prejudice observation and mal observation. Now, as we know that, and one more point here that we can include is non-observation, means not at all observing what is in front of you. We are just not paying attention to that. There are certain things which are present, but as we might not have that sight, and that can come with the experience or by focusing with the proper focus. So the hurdles which can come when the case is not case to improve the quality of case taking, that can really come when we are in a centered state, we are emotionally and mentally in a relaxed state or balanced state, again the way of unprejudiced, or when we are not involving ourselves into the life of patient. See, one of the thing that is very important might be very small for all of us, because all people who are there are really really very experienced practitioners. But when we look into that way, that really when we are not in that zone, we might messed up with the prescription. So my point of being balanced, again, one of the example which I always give, that in initial days we had a very very good learning experience from our sir. And daily we used to take check on each other that how the case taking is going on, and how we are making it more precise. And it was one of the day that I had taken the case of a person who was having psoriasis, and we know that psoriasis has that triggering factor, that stress factor, which is there. But somehow I was not able to find anything that is correlating with my patient's complaint. No elements from that was matching up with the patient's complaint. Only the physical data was there. My patient was also very much introvert, and I was juggling of gathering the proper case taking, and I had given my all best shots. I tried to be patient. I tried to listen to the patient. I have tried in a different way, that where I can get the more information. And I was knowing that my case is not concluding of any causative factors or what the personality factors that the patient is, why the patient is suffering. And I was curiously waiting that I will be there sitting with my sir, and I will observe like what sir is trying. I was actually frustrated with that juggling between the case. And when I saw that how sir started, sir saw the whole history and whatever I had written, and then he started exploring the professional life in much detail. And that person was business person, and managing the stocks. And it all started, he there was something wrong with his stocks, and he was constantly facing that trouble with the business, and so on. That since then, when he started doing that loss in the business, the skin complaint actually had started. And I was like, okay, so the different way of exploring the cases will change from patient to patient, from person to person. So there should be a site of opening up the case in different ways. For some, it may start with just even the professional life. For some, it may start with ailments from, and from some the different approaches can be taken. So that time I learned to observe what is important for our patient, and need to see in that eye, so that we can start and understand the connecting factor that is actually bothering our patient. So this was again my experience, where I thought that how to make my case more perfect. And one of this had made me on that ground, that yes, I need to be seeing whole aspect of our case. So in this, all about this prejudice and observation, the next point that I would like to say is completely non-observation in for the patient that I did in some of the aspect. So non-observation again includes not having that sight for observing the patient detail that patient is putting in front of. So many a times when we are trying to collect the case details in one day, it was that I saw that I had few patients waiting, and one of my patient had come with a severe acute problem of itching. And I was just understanding, and constantly she was worried. She was worried about her son. So I was writing the detail, and then she was constantly checking phone and just not talking. So it was not initially that I understood that my patient was really worried about her son. But then when I gradually I had gathered all the details, and while finally coming up with that prescription, so then I noticed that why she is constantly checking the phone here and there. And then I came to know that she had actually been worried about her son, who has really not called her up after the tuitions are over. So this is one point where I actually got it very lastly, which I should have been seen previously, because since the case started, my patient was constantly trying around to see that update from the sun. So this is one of the example where non-observation, luckily I got that into the play, but again it can lead to this kind of things, missing of the things. And again, with observation, one more example what we can think about it, that there are many patients we see that we might see that have fear of death, or they are very religious patients. Yes, religious patients. So when the patient is religious, and when we work with the students, like student come and tell, ma'am, patient is very, very religious. Okay, I say, how do you find that the patient is very religious? So, ma'am, he had done that tika. He goes to the temple regularly. So, okay, fine. And what does he do? He does fasting every week. Right. He is you doing it very regularly. Okay, fine. So, is it enough to label our patient religious? Probably yes, but what is the underlying cause of being so religious? For us, taking the case into the consideration, this small things matter. So when we came to know, and when I asked my student that what is the main reason of the patient being religious, there was no answer. And then once we interrogated with the patient said that they feel really very much burdened because of one of the mistake that they did in filling up the tender. So he feels that it is completely because of me that my company might be suffering a big loss. So I'm praying to God since then that it should all be well, it should all be managed well. And what if it what is the reason? So the reason is completely different. So what we see is the probably the tip of iceberg, but the underlying cause can be really different. Same here, the religiousness, we have different in stramonium, we have religious mania. The reason, the presentation is completely different. The thing that the case what I talked about was aurum metallicum, where the guilt and everything is the patient is taking on himself. And the same way, when we think about religiousness because of fear of infectious diseases or because of fear of death, then it can turn out to be arsenic. So these all are the presentation of religiousness. So here also one point is that little bit difference in our case can really change the remedy. Of course, we are considering the whole picture, but to make the whole picture of the patient very clearly, each and every symptom that we take into the consideration of totality should be evaluated and understood completely and properly. So, on the part of observation, these are the points I wanted to share. Now, second important point, with the help of Organon, I want to emphasize on is the knowledge of physician and the aphorism of knowledge, the aphorism 3, knowledge of disease, knowledge of physician, and application of both the knowledges. So, in application of both the knowledges, firstly, we know that there are different ways where the diseases are present. Like there are symptoms of the disease, but we as homeopath have to see the symptoms, those make our patient different in suffering. So once it so happened that recently one of the patient had very high fever, and nowadays, the viral fever is going on, typhoid fever is going on, throat infection. There are different cases which are coming up in our clinic. So, this was the case where the patient started experiencing severe headache once in the evening, and it started increasing. And by the morning, the patient had severe high grade fever with lot of sensitivity and lot of a kind of restlessness and not comforting situation. So when the patient brought to the clinic, he was already having fever, had taken paracetamol to control the fever, but still, even after taking that allopathic medicine, the headache was not going. So the most persistent complaint was headache. And by the time it was a pediatric patient, by the time it came to the clinic, that the severity has really increased. The patient was not leaving the mother and constantly crying and very upset, and also had a history of vomiting twice. So these were the symptoms that were actually present. There was no causative factor, like no food that was associated, or probably in the recent time, nothing was, no causative factor actually was coming up. So I made a totality, and two remedies were coming nearby. Yes, one more symptom that I observed was the tongue was very thick and milky coated. So, in that way, there are different remedies roaming in my mind, that which medicine can be given as the similimum. And uh, there are medicines, I was also suspecting the presentation nearly to the typhoid fever. So, being more onto the ground of typhoid fever, though the reports were not confirmed, I was thinking about the remedies that can be used in that as well, in enteric fever, in typhoid fever. But I made the totality of symptoms, and initially I felt like, because of the presentation of irritability and restlessness, chamomilla can be given. But the tongue symptom, the thick white coated tongue, was very, very prominent, cannot be ignored. So I checked the synthesis repertory, and into that, the thick white coated tongue is present in the chapter fever. So that was more than enough. So I was juggling between chamomilla and then belladonna, and I finally started giving belladonna to the patient. And within half an hour, the fever almost touched the baseline. And after that, I continued giving belladonna in water doses, and the patient was out of fever. In between, the fever was coming, but again coming down. And before, when the typhoid fever, the report came positive, by that time the patient had actually been out of the fever. So he had no fever. Of course, the symptoms which were there were presented, but rest of the things were taken care of. So here is one more example, that taking case well, not being prejudiced, using the repertory, because I had never thought that belladonna too can have this white, thick coated tongue. And sensitivity, headache, heat, and the high grade fever were definitely confirming my prescription of belladonna, and it worked very nicely. So here, if we think about the knowledge of the disease, then because of the knowledge of the disease, we could understand that this could fall into this typical category of this kind of fevers. But also we need to see that special aspect, that speciality, that individuality of our patient, or the symptoms present at that time, so that the prescription can be really right, correct, and helpful. So again, by not being into that zone of the things, we can really apply the knowledges and make the prescription really right. So this is my one of the way of telling this. Now the second part of this sentence, like this is all about like taking a case well. Of course, it does also include noting down the all the information precisely in chronological order, making the symptoms full symptoms, that is with location, sensation, causation, modality, and concomitant which are present in any of the ways, and physical history, family history, and all that we know the case format that are there. But while exploring mental aspect of the patient, again there are certain tricks, or there are certain things which we can pay attention to, because finding mentals can be really challenging in initial practice days. So, because as Neha ma'am also told that I do practice other modalities where we deal with subconscious mind, and homeopathy actually is based on the mind and body coordination. Our Dr. Hanneman sir has already given that all diseases we can consider as psychosomatic disease. So, finding out the real mind or mental symptoms can be challenging, because everybody, any patient is open when you are talking about physical complaints and physical symptoms, but when we try to explore the mental, how many patients are going to come and tell you about their fear on the very first visit? that's it's difficult. How one can confess that they are jealous or having suspicious about their spouse, or they are having insecurity, or they are dealing with financial struggles? How many patients are going to open up with you? So building a rapport can really be helpful and in receiving the right information of our case. Also, one which is a very small thing, making the patients aware about the whole process of case taking. Because many a times it happens that patients are just coming then, and when we ask, they will say that, ma'am, I have this problem and I've come for this. I don't need to share my whole history to you. And then we know that our patients were not even aware about actual process. And once we have made them aware, the way they cooperate can be really, really beautiful. So, bringing that awareness of homeopathy, the case taking, can be really, really enlightening to the patient, and that only can give much relief to the patient. So even I would like to emphasize, like many a times it can be practiced that we can give the forms or simple questions to our patient. So before coming to real case taking, they are actually aware and acquainted, and they are in tune. They are connected with themselves, and it makes the thing easier for us to find out the real mental symptoms, which can be really challenging. And many a times, according to the personality of the patient, introvert patients might not open up to you in the very first meeting. Like again, one of the intern student was taking a case of one of the patient, and she was very adamant. She was knowing that that old man had something in the mind. We also sense, right, with the way the patient present to us, that there is something that our patient is not willing to tell. And she was like, no sir, you have to tell me what is the stress that is bothering you, what is the stress that is coming to you. But the patient was not that comfortable. Characteristic of our patient, that not willing to share the depth or the painful situations what they are having, what they are suffering from, right? So this is what is taking mentals can be in that challenging situation. So again, the awareness to the patient, different ways of dealing with the different patient. Each patient or each case can be a different thing. Like with one of the case, it happened that my patient actually showed me the real reason of her stress in the third meeting. But fortunately, we started with the case with the nosode, prescription of nosode, and probably that has helped her to open up more and tell us more about her case. So, in patients where the suppression is more, in patient where they are vulnerable emotionally, we have to be really, really compassionate and providing that space so that patient can open up. Also, I practice with my in my clinic, where the patients, if are not ready to show their about their feelings, I ask them to describe the situation. Say for example, while noting down the feelings of, what are the feelings of anger, or many of us might say that I do get angry, I don't get angry. When we ask the questions like about anger, there can be yes or no, right? And in that way, many of the patients say I don't get angry, or some will say that I do get angry very frequently. But when we try to describe what is the reaction, they might be like clueless, like what is this? And at that point of time, when we ask them about the last time they get angry, and if they describe the situation, it becomes easier for us to gather the proper case details. So this is also one of the thing. And when somebody says, denies that no, it's not happening to me, then that is also a kind we need to note down, so that in some of the ways where we see that the case is flowing, we can ask that thing again. So this is about the first part, a well taken case. That is, these are the points practically which should be understood by our students. And even in our busy practices, these are the different techniques we can use to find out and make our case more strong, because that will help us in prescribing better. And now, when we say that a well taken case is half cured, what I mean by this is by when our patient comes to a homeopath, many a times they have already been suffered a lot. They have tried different methods, they have taken different medicines, they have been to the different clinics, and maybe that is something that illness is also bothering them. And in our pathy, I proudly say that we listen to our patient. That is the beauty of homeopathy. We always listen to our patient, and that is that listening is an art. And with that art, the patient will feel listened and acknowledged. When that acknowledgement comes, when they are able to share, and as rightly said in Organon, that a homeopath is friend philosopher, and we are preventing our patients, we are taking care of the health of our patient, and in all the ways we are there for our patient. So when somebody is there who is listening to you non-judgmentally, who is there to understand your pain patiently, and who is taking care of your health, isn't it that is soothing to our patient? As a person, it soothes us, and so the same way it soothes our patient. That listening attitude, and that helps our patient connecting more with himself. And one more experience that one of the patients shared was that, ma'am, I had never ever thought so much about myself. This is the time where I'm actually connecting with myself, when I'm diving deeper into my experiences, or I'm understanding my point, right? That why it is happening to me, or why this is what I am feeling. And I've never shared with anybody. But after telling you, I feel so relaxed, because we are the person who keeps their information confidential. And once that inner suppression, once those feelings are released, then definitely the patient is feeling better. So one is also many times the patients will come to know that this is happening, this is what they are feeling. And anytime when you are really treating or healing a patient, first step is awareness, whether be it with the disease, we are making ourselves aware with the disease, that or making ourselves aware with what is to be cured in our patient. What is to be cured is very important, right? We are here to cure what needs to be released from our patient. It can be any negative feelings, any fear, that suppressed anger, that conflict which is going on, and whatsoever. So, as case taking is a beautiful art that we homeopaths hold, by the listening and non judgmental, unprejudiced attitude by a homeopath, our patient feels listened, and that is the starting of the cure, because that is the way they release their feelings. And we know that how beautifully in homeopathy we believe that mind and body is connected. We all know that, but still I'm making a little humorous example to everyone, because to see the mind and body connection, like whenever we are angry, we don't need to say our eyes that be red. We don't need to make our fist, we don't have to say, we don't have to say our heart that please beat faster, I'm angry. It all happens automatically. So the feeling in the mind gives your body reaction in action. And same way, when you are having headache, you don't need to say that, oh, I feel, in patient might feel bored, patient might feel tired, patient does not want to talk. That is the body that is affecting the mind. And so once we make our patient so in that relaxed state of mind, will it not bring the cure? It will definitely start the cure. And our patient many a times, in my, let me tell you my experience, like when I had really given my case, when I was studying homeopathy, I had decided that now onwards I'm not going to take any other medicine but only homeopathy. And that time one of the assistant doctor from my sir's clinic had taken my case, and after that I was so relaxed, I was feeling very happy. And actually I would say that I had constipation, and it was all cured with just after the case was taken, honestly. And I this is the beauty of case taking. Yeah, you are holding the things, and once that is released, your stress is released, and the body starts working, the body starts feeling healthy. So this is the beauty and art. That's why we say that a well taken case is half cured in the way of psychology. And when a case is well taken, we have everything in front of us. We have totality that is clear. We have rubrics, we can make that clear. And we for us, finding out the remedy can be very easy and interesting. Also, we can also see the complementary medicine or the future outcome of the patient, or we can be ready with the medicines that we might require in future. And this is how. So that is why the importance of case taking and a well taken case is half cured are the golden words by our master Hahnemann. And my deepest gratitude to Master Hahnemann sir and everyone who is present here for listening to me very patiently. And so thank you so much, everyone. So this is all I wanted to share for today's session. Yes, ma'am.
Yeah. Thank you, Dr. Ratna. Stop it. Just a second. Yeah, it was a wonderful session from you, Dr. Ratna. You explained different aspects of what to take in a case and what not to take in a case, and also how to approach the case by different modalities, by different, from the mental perspective, from the physical perspective, and different approaches you guided us about. It was a very wonderful session from you.
Thank
And
you.
now we can move on to the question answer or interaction section session, where the doctors present here can ask their questions and also can provide their inputs for the case taking part. So
Yes,
I would like to have Dr. Hariharan. He is raising his hand.
yes, sir.
Okay, madam.
Yes, Dr.
Nice.
Hariharan.
Okay, madam. Nice presentation.
Sir,
Thank you,
please
sir.
unmute yourself.
Okay, okay, madam. Can you hear
Dr.
me,
Hariharan,
madam?
can you
Can
hear
you
me?
hear?
Yes, yes.
Yes. Very nice presentation. Traveling from mind to physical ailments. Very good. Very good.
Thank
Very
you,
good.
sir. Thank you, sir.
See, I'd like to ask one question. That is, see, suppose a person is genetically having some mental character, mental character. Suppose anger or ambition or such character. Yeah, and on going to his way to the age, see, he may have some ailment, physical ailments happens. And suppose we give the homeopathic medicine, will it change the genetic character of the patient? That is my question.
Genetic character. So what I understood, sir, was that the patient was having genetically certain complaints, and with that, can we change that with homeopathy? Is that the question?
Correct. Genetically, he is having some special character, such as
Okay.
anger,
Hmm.
ambition,
Hmm.
or such a character, and that
Right.
causes that special, mental that character make him the physical ailments.
Mm-hmm. Right, sir. Sir, in homeopathy, we personally, from my experience, I have not come across of any such challenging cases. But what I've observed with other my professors or from whom I have learned, I have seen that we can, if given the right constitutional medicine, we can make the things much better. Might
Answer.
not be might not be 100%. Yeah.
कौन दोस्त बोल रहा है नाम बताओ
Some other persons talking.
Yeah. So maybe not fully, but yes, we can have a great improvement because we do know that we have homeopathy in prevention of the diseases that can be transferred from generation to generation. Say, for example, in a common way, that diabetes mellitus is very common. At least anyone in the family member must can have diabetes mellitus. But when we are taking precaution and we are taking homeopathic medicines, the chances to those who are taking homeopathic medicines, the diabetes mellitus will be less effective or less common. To that person will be less affected or have lesser chances of getting diabetes mellitus. So in the same way, what you are saying, that in genetic transfer we can make the patients nearly much better, but telling 100% again will depend on the condition of the patient and the surrounding factors too, because that I think that plays major role of the for the patients about what you are talking. So if the caretakers or the family members can be made aware and supportive, then we can have wonderful results in that. That is from my experience or my knowledge I am sharing. I would want other experience, I would want to know others' opinion on that as well, to guide me for the same.
Okay, madam. See that you said the proneness of disease. We can decrease the proneness of disease by
Right.
giving homeopathic medicine.
Right.
Okay. Thank you,
Yes.
madam. Thank you.
Thank you, sir.
Yeah, thank you, Dr. Hariharan. Now, if anybody else wants to interact with Dr. Ratna, they can raise their hands. Yeah, I would like to add in here, like Dr. Ratna said, that what we need to look in the case. Like the main thing that in my experience I would like to share is the PQRS symptom, which we say, because we need to find the peculiar symptoms which we need to elicit patient, be it the sensation modalities, whether the causation modalities or the modalities of time. Anything can be the factor which is a pointer to the medicine, because we need to get that pointer in order to take out the medicine, because we have a lot of medicines for any single disease, and that is the toughest job for the homeopath, to elicit the medicine from the patient by covering any of the symptoms which we need to look. It can be the pattern of their dreams, it can be the pattern of the thirst, it can be the pattern of their, the desires for food and whatever aversion and desires, it can be their sweating mechanism, it can be their certain mental characteristics. And we as a homeopath need to have that psychologist eye. We need to have to read the patient's body language also. That also conveys a lot of things sometimes, like you said that the patients are not able to tell many things in the first or even the second or the third visit about the mental makers. But we as homeopaths need to study the body language, their eye movements, and the way they are talking. Sometimes we get an idea from those things also, that what kind of a person the patient is, whether he's a aggressive personality, or whether he's a soft personality, or whether he is, a suppressed personality. We also need to study it without asking. We need to
True.
have that skill also as a homeopath. So in
Hmm.
my opinion, these all things also help us to take the case and help us to, find the right remedy.
Very true, ma'am. Yes.
Very true. Very true. Very true.
Yeah.
Very true.
And anybody
Okay.
else want to?
Madam, actually,
Yes, ma'am. Yes, sir.
that subtle state of a person
Yes, sir.
is actually that the physical contour, physicality of the person is actually the subtle state of the person. That
Yes.
subtle personality is based upon genetic genes.
Yes.
Genes. So I think we can change that genetic character also by homeopathy, because the homeopathic medicines is acting on the subtle state of a personality.
Yes, sir. I also made a presentation on a genetic disease. If you remember, I presented a genetic case in the forum a few days back only. That was that child has an intellectual disability, and he's diagnosed with KBG syndrome. That's a genetic disorder. And I'm still working on the case. Recently, I prescribed him some medicine and he had a severe aggravation also. He turned violently aggressive after taking the medicine. And but now the things have settled down. So yes, obviously homeopathy can work on the genetic level, and many more cases are needed to establish these facts, because when we'll have the cases, we will, document them, and we'll have that data where we can proudly say that we can cure and treat genetic diseases with homeopathy. So yes,
Very good.
Dr. Hariharan, your point is very true. And if it will be very nice if many people would come, many doctors would come up and have the courage to take these cases in their practice. And even if we are having failures, like I said, that patient had severe aggravation, because it's very difficult to explain also to the family members about the aggravation part. That is the most difficult part as a doctor, and it is very difficult for the patient also. So we need to keep the patience, and we need to have the courage that even if we are having troubles and roadblocks in that path, we still need to be consistent in our practice and take these cases. And if we have the blessings of Dr. Henneman and God, we can surely cure them.
Very good. Very good. Very
Yes.
good. Your observation is very correct.
Yes, sir. And we have Dr. Bob Lim with us, sir. Dr. Bob Lim, can you hear me? Dr. Bob Lim is there. He was just there. Now I guess he's not here. We could have.
So sorry, I
Yes,
cannot
yes,
speak
sir.
so much.
Please.
I'm outside having my
Okay, okay.
tea.
Yeah, yeah.
So
So
in the
can
public.
you can you provide some of your inputs also on case taking, sir?
No, I think Dr. Rashida has done a very good presentation how she take a case. And I think she did it from a different point of view. And today we are learning from her also, and from everybody. And with Dr. Ram also is here, and Dr. Hari. Maybe we can hear more from Dr. Ram.
Okay, okay, sir. Yes, sir. Dr. Ram Parvesa, sir. Please, sir, आप भी कुछ बोलिए. आप अपने
Thank
input.
you, Dr. Neha Kokar. Congratulations, Dr. Ratna Bhatt. Really, frank session,
Thank you, sir.
dynamic lectures, beautiful describe collection of symptom, patient, a kind of art. Really, mind, body, yani vital force, mind, body. There are three main thoughts. Subjective symptom is a very important symptom. Subjective symptom then produce objective symptom. Main cause of disease, according to law of homeopathic, subjective symptom is a very important symptom. Sign and symptom, other objective symptom. Thank you, Dr. Ratna Bhatt. Very good, beautiful describe observation of patient according to law. Thank you.
Thank you. Thank you so much, sir. Thank you so much for the valuable input, sir.
And we have also.
See, time is nearing, but see, a rare, peculiar, uncommon symptom may come as a totality. What is your opinion?
Pardon,
Sorry,
sir?
Rare, peculiar, uncommon symptoms may come as the totality of symptoms. What is your opinion regarding that?
Rare peculiar symptoms may come as totality of the symptoms. Sir, in that we have, a kind of 3 or more symptoms such coming up, then we can be sure on the prescription if they are very rare, peculiar. So we can use this way, I suppose. And yes, that's all I can collect right now. That's what I feel. Because if they are really rare and peculiar, then we can easily differentiate that, and we have the very less remedies covering that. So as ma'am also said that we can differentiate more with the constitution, we can see more with the physical aspect, and we do have other symptoms that can actually help us in confirming and supporting those rare peculiar symptoms. So I think that prescription can be made and make sure with the help of repertory, because I feel that repertory is one of the very important tool for the confirmation of our medicine or prescription. So that is my view, sir.
Okay, thank you, madam. Thank you.
Yeah. Okay. Anybody else wants to provide their inputs or ask some questions to Dr. Ratna? You were asking Dr. Dhruvi Panchal something. You can ask her now, Ratna ma'am.
Ma'am, she says that she is working somewhere right now, so she can't answer. Okay.
That's okay. Yeah.
So,
Okay. Yeah, so I would like to also add in here that homeopathy, like you are practicing in different modalities like past life regression and Reiki and other things like theta healing and all these things. And also, these things are also working on the metaphysical level. And slowly, the world is now recognizing the fact that the non-physical or the metaphysical part of the organism is much more important than the physical part, and that is the part where the disease is actually starting. Like yesterday also we had a session with the doctor, yesterday session in English that was about health, and he also talked about future of the healthcare. He described about the history of health, then he moved on what will be the future. So the future lies in these systems more. Obviously the modern system needs to be integrated along with these things. Modern system is the basis, because without the knowledge of the basic disease and all the organ system and whatever the modern medical science, and the biggest point of that is the technology that the modern system is providing. Now we are having, uh, recently I had an article which read about xenobots, where they are creating robots to uh, get inserted the cells. They are creating robotic cells which can cure diseases. So obviously that part is very much the center of the healthcare system. But these systems like our system of homeopathy and the different systems which you are practicing, which have the metaphysical part, they also play a very important role in the future of healthcare. And we need to integrate all these systems. Then only we can have a holistic care, which Dr. Hahnemann describes in Organon, the holistic treatment of an organism that we can take forward in future. So we have 3 minutes left. If anybody else wants to, say something, otherwise.
Doctor, are you practicing with Reiki also?
yes, sir.
Okay.
I do practice Reiki. Yes, yes.
Right.
So actually, homeopathy has when I started learning homeopathy, it was also not planned because I got less marks, being honest, and I came to homeopathy. But then in first year also, only I was amazed with the pathy that I have brought into, and so I learned about psychological aspect and so on, and that is how my journey started. And I kept on exploring how we can cure some a patient without even giving medicine. And yes, so then I learned Reiki, and then I theta and other different healing modalities. Regression is also one of the very, very beautiful way of releasing suppression from the patient by taking that patient in a process of hypnosis, and releasing subconscious blocks might be helpful in patients like McCarp, Staphysagria, Mac group, where they are really repressed with their emotions. So that can be helpful. So with selective patients, I do practice that because the willingness of the patient is also very important. So that is how, but that has got excellent result. And in more deeper level, past life regression, with few cases, of course, I have recorded them and they are beautifully working. So that is how, sir, it all came to me. So that's why grateful to homeopathy and grateful again to all of you for listening to me and providing your valuable inputs. Thank you so much.
Yeah, thank you,
Thank
Dr.
you, Neha.
Ratna. Yeah, I would like to invite Dr. Ram Pravesh sir to say vote of thanks to Dr. Ratna.
Thank you, Dr. Ratna. Beautiful described collection of symptoms in the patient. Very, very thanks. Yeah, IFPH.
Thank you
Again,
so much.
again, again, in this forum presentation. Thank you. Very, very
Thank you.
thanks.
Yeah.
Thank you.
Thank you, Dr. Ratna, for coming here and sharing your wonderful insights and your experience and observations on the topic of case taking. And we would also like to have you in future again with
Thank
different
you.
topics and
Sure. Thank you.
also some cases also from you. That will be very nice. Now I will be handing over the session to Dr. Mariamma John for the Malayalam session. Thank you, everyone, and good night.
Good night.
Thank you, Neha.
I'm making you the host, ma'am.
Thank you, Dr. Neha.